Welcome to part 2 of the 2022-2023 Oneida Herkimer Madison BOCES online awareness training for mental health. In this section, we will discuss disorders of mental health and mental illness. Although this training discusses these disorders, it is not meant to be a replacement for training from mental health professionals. Mental health or mental illness disorders include, but may not be limited to, obsessive compulsive disorders, psychotic disorders, eating disorders, substance abuse disorders, mood disorders, personality disorders, anxiety disorders, behavioral disorders, suicidal behavior, and trauma and stress-related disorders. Obsessive compulsive disorder, commonly referred to as OCD, is a disorder characterized by repetitive actions that seem impossible to stop. There are times when medical attention is usually recommended by healthcare providers. OCD is very common, impacting more than 3 million cases per year in the United States. OCD is treatable by a medical professional and often requires a lab test or imaging. OCD can last several years, or it can be a lifelong affliction, and is common for people ages 18 to 35. A family history of OCD may increase the likelihood that this will impact someone's life. Psychosis is not a mental illness, but a symptom of mental health conditions including schizophrenia, bipolar disorder, and depression. It's more common than is normally discussed and can be very scary and disorienting for the people experiencing it. Many contributing factors can lead to a psychotic episode. These factors include, but may not be limited to, genetics, trauma, substance abuse, physical illness or injury, or other mental health conditions. The symptoms can include, but again, may not be limited to, delusions or paranoia, hallucinations, an inability to concentrate, sadness, sleeping too much or too little, losing bonds from family and friends, fearfulness, and suicidal thoughts. The symptoms of eating disorders may vary depending on the type of eating disorder. Anorexia nervosa, bulimia nervosa, and binge eating disorder are the most common. Other eating disorders include rumination disorder and avoidant restrictive food intake disorder. Most eating disorders involve focusing too much on your weight, body shape, and food. The causes of substance abuse can include, but again, is not limited to, an unhealthy social environment, stress, isolation, or even discrimination. Treatment can include medication and different types of therapies, including behavioral or group. Drug use affects people from all walks of life and all socioeconomic statuses. Whatever the reason a person starts taking drugs, whether recreationally or prescribed, tolerance, patterns of increased use, physical dependence, and ultimately addiction may develop. Affective disorders are a set of psychiatric diseases, also called mood disorders. The main types of affective disorders are depression, bipolar disorder, and anxiety disorder. Symptoms vary by individual and can range from mild to severe. Personality disorders are a group of mental illnesses. They involve long-term patterns of thoughts and behaviors that are unhealthy and inflexible. Every person experiences anxiety at some point in their life, for example, during an examination or an interview. This may last for a limited period. It is classified as an anxiety disorder when the symptoms are recurrent and last for a longer time. Symptoms can include, but are not limited to, restlessness, increased heart rate, chest pain, dry mouth, hot flashes or chills, sudden trembling, dizziness, avoidance of situations that may cause fear, obsessions and compulsions, a sudden feeling of panic and fear, uneasiness, nausea, cramps, sleep-related problems, such as excessive sleep or sleeplessness, cold or sweaty hands and feet, numbness in the hands or feet, and a shortness of breath. Behavioral disorders can be impulsive and disruptive to everyone around them. There used to be only a few conditions within this category, but as of the Diagnostic and Statistic Manual of Mental Disorders 5th edition, otherwise known as the DSM-5, it has expanded this category by adding new disorders. These are behavioral disorders currently identified by the American Psychiatric Association and the DSM-5. Attention deficit hyperactivity disorder, oppositional defiant disorder, conduct disorder, intermittent explosive disorder, and disruptive mood dysregulation disorder. Suicide, or taking your own life, is a tragic reaction to stressful life situations, and all the more tragic because suicide can be prevented. Whether you're considering suicide or know someone who feels suicidal, learn suicide warning signs and how to reach out for immediate help and professional treatment. You may save a life, your own or someone else's. Suicide warning signs aren't always obvious, and they may vary from person to person. Some people may make their intentions clear, while others keep suicidal thoughts and feelings secret. Some warning signs can include, but are not limited to, talking about suicide. For example, making statements such as, "I'm going to kill myself," "I wish I were dead," or "I wish I hadn't been born." Getting the means to take your own life, such as buying a gun or stockpiling pills. Withdrawing from social contact and wanting to be left alone. Having mood swings, such as being emotionally high one day and deeply discouraging the next. Being preoccupied with death, dying, and violence. And feeling trapped or hopeless about a situation. Additional warning signs of suicide can include an increased use of alcohol or drugs, changing your normal routine, including eating or sleeping patterns, doing risky or self-destructive things such as using drugs or driving recklessly, giving away belongings or getting affairs in order when there's no logical explanation for doing this, saying goodbye to people as if they won't be seen again, and developing a personality that changes or being severely anxious or agitated, particularly when experiencing some of the warning signs listed above. Trauma and stress-related disorders are a group of emotional and behavioral problems that usually arise from exposure to traumatic and stressful experiences. The disorders are serious psychological reactions that develop in some people following exposure to traumatic events. This may involve witnessing or being the victim of a situation that is actual or feared, that could cause death or serious physical or emotional injury. This concludes our Mental Health Awareness Training Part 2. Again, although this training discusses these disorders, it is not meant to be a replacement for training from mental health professionals. Thank you.